This meeting is being recorded.
All right, welcome. Thanks so much for being here, to all of us who are here today. And I'm really excited, Lisa, that you were able to do this program for us and that we're recording it so that as part of our Get Ready, we're talking this month about caregiving, and definitely our agency. I'm going to do it again. Aging adult and care agency, provides a lot of resources for us. And so thanks for being here. And I will let you introduce yourself, and away we will go with Lisa's presentation.
All right. Hi, everybody. I'm Lisa with Aging and Adult Care. I'm the Information and Outreach Specialist. So I do things like these programs to let people know about our services. And I also answer the phones and, take all the new referrals for people in Okanagan County. So I see a lot of our community members that way. All right, let me share my screen here. And we'll go through this PowerPoint. Okay, oops, let's get back to the
I know there's so
I hit my mouse and we just went for it.
I know,
right.
I know.
Let me start it over here. And I won't hit my mouse this time. All right, can everybody see that then?
Yeah. Yes.
Oh, perfect. Okay. Let's get back to slide 1. And I'll try not to scroll. All right. So this is an overview of the agency and programs and services that we offer. So what is an area agency on aging? So the United States Congress enacted the Older Americans Act in '65, and this was set out to, this act set out specific objectives for maintaining, well, my button is just crazy over here. I'm so sorry. I hope I don't make anybody motion sick right now. There we go. All right. So this act sets out specific objectives for maintaining the dignity and welfare of older individuals. So the Aging and Adult Care of Central Washington is one of 13 area agencies on aging in the state of Washington. And we serve 6 counties. We serve Adams, Chelan, Douglas, Grant, Lincoln, and Okanagan counties. We have 3 offices in East Wenatchee, Moses Lake, and in Omak, and I work for the Omak office. So Aging and Adult Care provides some services directly, and with other services, we contract with local agencies. Services are provided for those who are 60 and older and those who are disabled. However, there are some programs for those 55 and older, and our Family Caregiver Support Program is for those 18 and older. So we have 2 main programs that provide in-home care services for our clients, and we using Medicaid funding. We have Community First Choice Program, which is often referred to as CFC, and Community Options Program Entry System, or commonly known as COPS. CFC was established by the Affordable Care Act, and this program allows DSHS to offer more extensive benefit packages so individuals can remain at their home instead of moving into an assisted living or nursing facility. COPE stands for Community Operations Program Entry System and covers the cost of items such as personal emergency units or those emergency buttons you see on TV, medical equipment, and home modifications such as widening the doorways and ramps. Medicaid funded programs have relatively restricted funding functional requirements, meaning activities of daily living. So they might need help with medication management, transfers, ambulating, and such. It also has really strict financial requirements to qualify.
Lisa, can I ask one? Is it okay if jump in here and there?
Yes.
With the COPES and the medical equipment, do you have to be on Medicaid in order to qualify to receive any of that?
Yes, for these programs, you would have to be on Medicaid. It's a Medicaid program, and it covers the ramps and stuff. However,
okay.
We do have other programs that are Medicaid alternative programs, and they can also provide a ramp. So, and those programs are nice because they have a little bit of a higher income cap. You don't have to be on Medicaid to qualify. And I think it talks about that program a little bit later on in the slideshow.
Okay, great. Yeah.
All right. So those Medicaid programs, CFC and COPES, also have something called estate recovery to them. So some people who benefit from Medicaid programs, they don't apply because of the estate recovery. But one of the things about estate recovery is if your spouse is in the home still, or your spouse is using some of that funds to pay for their own living, the estate recovery doesn't start right away. So there's a lot of ins and outs of estate recovery, and it's best just to apply and see what they say so you can talk to a financial worker and get your case specific information. So services available under CFC and COPES, there's a wide range of services available. One of the services is you get a case manager, and the case manager can kind of act as a liaison between the home care agencies, your caregivers, and other community organizations that you're working with. They also monitor your care, and you can reach out to them when you have some issues. Another service we provide on CFCs and COPES is nursing services. We have a nurse in each of our offices. So if your CFC or COPES client has, like, let's say a bed sore, the case manager can refer them to the nurse who will reach out to them to kind of assess the sore and talk to them about ways to help themselves. Okay, a wide variety of services are also provided under community CFC and COPES. We talked about the environmental modifications, and we can also provide other equipment like the lift chair shown or incontinence supplies and home delivered meals. We can also do those personal emergency response buttons. And the thing about these is you don't have to be only on CFC, COPES, or Medicaid to get them. We can provide those to anybody over 60 who cannot afford them for themselves. So anybody over 60 who needs one and can't afford one, we can help despite, it doesn't matter if they're on Medicaid or not.
Lisa, just so you know, we're still on the estate recovery slide. That's the one I'm seeing, so I'm not
okay.
sure.
Well, goodness, I am way past that slide, so.
I'm not sure why.
Yeah, let's see. Let's try it again.
Sorry, you guys.
Yeah, I'm so sorry. It was kind of preset.
This is
that the same then?
This is non-Medicaid and pre-Medicaid programs.
Okay, so perfect. This is where I was at in the presentation. Okay. I'm so sorry you guys missed the other slides.
That's okay. No problem.
All right. Well, I can share this to you, and anybody who wants it, we can send it out in an email too. So aging and adult care receives other federal and state funding to provide services. Some of these services are the ones also available through our Medicaid funded programs, but other unique services are available through non-Medicaid programs. The non-Medicaid and the new Medicaid alternative programs are administered through our Information and Outreach Department. Let's see. So information and assistance. When a person calls or visits our agency, they're connected to an information and assistance person. Our staff asks about the person's needs or the needs of their loved one to help determine the resources or services that can be most helpful. The information and assistance staff provides advocacy, education, information, referrals to programs, and community services, as well as home visits to assess and manage services. There are 4 direct programs through the information and assistance branch. So we do the Aging Network Chore Program, which just helps people over 60 do some light housekeeping, some laundry, or maybe a couple trips to the store. It's very limited at 4 to 6 hours a month. And we have a Family Caregiver Support Program. And that one is designed for people who care for a loved one, people who care for a family member, a neighbor, a church member, anybody like that. If you're providing free care to somebody, we can help you with the Family Caregiver Support Program. There's also the Medicaid Alternative Program. You have to be on Medicaid to access it, but some people access this because they don't want to do the estate recovery from the Medicaid programs. So we can go Medicaid Alternative Care and give you a little less hours of care, but it wouldn't have the estate recovery attached to it. And then we have the tailored support for older adults. And this is one of my favorite programs. It has a super high income cap at $2,500 a month for the person applying, the highest of any of the programs. And it also has a very high asset cap. For a single person, we don't count their home or their car, and they can have up to like $53,000 in assets. A married couple can have $112,000. Again, we don't count their home as an asset on this program. It provides in-home care and all the fun stuff that all the Medicaid programs provide, but it's not Medicaid. All right, so this just talks about our Aging Network Tour program. Again, it's 4 to 6 hours a month of light housekeeping. Usually people access this after surgery or after an injury, just to kind of help them out temporarily. The Family Caregiver Support Program is a little bit of a more permanent program. And like I said, it can help people who are caring for a loved one, caring for a parent or a sibling, maybe a neighbor or a friend. And we can do stuff like offer respite, which is in-home care, to give you a break. We can do home delivered meals on that program, emergency buttons, and caregiving supplies. It's a really robust program. It has a sliding fee scale. So single people, if their income is under $1,800 a month, they'd have no copay on this. And married couples, if the married spouse is caring for the other spouse, they can have up to $2,400 a month in household income. And there's no asset limit on that program. We don't even ask about assets. So it's kind of a neat program for that. These slides are from 2018, and at that time, we were providing between 1,500 and 3,000 hours of respite care and home care to give unpaid caregivers a break. We use professional home care agencies to conduct those tasks. All the caregivers are trained, screened, and background checked. Very professional, and they work really great with us.
Sorry, Lisa, but we're still on the slide with programs with information and assistance. So
Goodness, I'm not sure
seems like
why.
it's not progressing.
Okay, well, I can't progress the thing, I guess. So let's just go through it, and I'm not sure how to fix the slides.
Okay, that's
All
fine.
right, so let's go to the next one. Okay, so we also work with Community Living Connections. It's a website. It's statewide. It's a statewide effort with all the area agencies on aging, and it provides more information about various resources. The site is www.waclc.org, and you can look up each county, and it can tell you different agencies in your county and what they do and what's available. I've noticed it's not super user friendly, but they've been working on it and updating it. So eventually we're going to get it really great. We also contract with SHEBA Advisors. SHEBA is a state health insurance benefits advisors. They're trained volunteers who provide free, unbiased information to help consumers make decisions regarding Medicare, supplemental insurance, Part D prescription drug plans, and eligibility for help paying for Medicare premiums and prescription costs. They've saved our clients thousands of dollars, and it's really great. They can even talk to Medicare on your behalf. So these are really great people. And if you have any questions about Medicare, or just want to see if you can get some help paying for it, or maybe change your supplemental parts, give them a call and they'll let you know what's available in your area and what you qualify for. We also have a long-term care ombudsman on staff, as well as volunteer ombuds. They're all trained to advocate for the rights of residents in long-term care facilities, such as nursing homes, assisted living and adult family homes, and veterans homes. So these guys are really great go-betweens. If a person living in a facility has an issue and they want to work it out with the facility, this is a go-between person. They can reach out to the facility and talk with the person living in the facility. And it's a positive way to work out little problems that otherwise could become an issue. We also have behavioral health ombuds to advocate and ensure individual rights are represented and services respond to the client's needs and preferences. We have trained staff to provide this service for people accessing Medicaid-funded behavioral health services in our area. So you do have to be on Medicaid and accessing behavioral health services for the behavioral health ombuds to assist you. One of my other favorite things we do is a senior farmers market nutrition program. This usually starts in May or June, and we provide farmers market vouchers for qualifying seniors. This year, we were able to give each qualifying senior $80 in vouchers to use at the farmers market. Last year we did 40 per family, but this year it was 80 per person, and it was exciting. People are so happy to get their fresh fruits and vegetables, and you can even get honey at the farmers market with these. We also work with the senior centers to help defray the cost of their meal programs. So when you go to congregate meals at the senior center, aging and adult care is helping provide that, and we really enjoy working with the senior centers. We've also helped them get those blood pressure machines you see into their center and other things. One program we have that's a little different than in our in-home care programs is our kinship program. This program offers funds to help grandparents care for grandchildren living in their home. We can also help aunts, uncles, siblings, and other family members who are caring for children who are not their own. We can help with paying for like school supplies and school clothes and other essential needs for those children. We can also attend IEP meetings with you, just to kind of be there to support you and help listen. And we can also go to court with you. We can't advocate or offer legal assistance, but we can be there as moral support and to listen and just kind of be a sounding board for you. We can help you, kind of remember what happened at the event or at the court hearing and stuff like that. Again, no legal assistance, but we are great moral support. We also do home delivered meals for people who for people who are on or off our programs. If you are 60 and older and homebound, you qualify for home delivered meals. This program has no cost. However, they do ask for a donation. So those who can or would like to donate are more than welcome to. Those who can't, that's okay too. We have funding to cover it. The home delivered meal programs are really great. And sometimes we can even get the unpaid family caregiver a meal, just to kind of help relieve the stress of the unpaid family caregiver by offering the meals. We also sponsor chronic disease self-management and chronic pain self-management programs. These kind of went to the wayside in 2020, and we are trying to get them going again, but we just offer virtual and in-person classes. We contract with somebody, usually a nurse or somebody in that profession, and do chronic care and pain management classes. We also have a small fund called the Client Specific Fund. This is for people over 60, and we can do things like maybe purchase a gas voucher for them if they have a long distance appointment. We can order things like air purifiers on them and air conditioners. There is a $200 limit, so the cap is $200 annually per family, but that can usually cover like, one window air conditioner, a couple air purifiers. We can do cleaning supplies and other little things on that too. We also contract with the Northwest Justice Project to provide free legal services to those 60 and older. They also provide legal services to those who are low income under 60. Currently, they are pretty swamped, so they're taking, high priority cases at a time. But yeah, it's a really neat thing. They have a great website, and you can go on there and look for, they have information on all sorts of legal things, elder care and family law. It's a really neat little website that they have. Okay. And one little program we have it's a really tiny program, but it's called Wishmasters. And we try to fulfill wishes for seniors, modest wishes they have. I think it's little things like a family dinner. We've paid to have somebody go out with their family and have a nice dinner. Just little things like that. A wish that a senior has. It's a small program. Not everybody gets selected, but if you have a senior who has a modest wish, and just let us know and we'll see what we can do. We also have a health homes person. So as a part of the Affordable Cares Act, DSHS and the Healthcare Authority have created health homes as a way to improve coordination between Medicaid and Medicare, and also improve the outcomes of individuals with chronic conditions. So a health homes person would call somebody that's on this program, and just, check in with them and see what's going on. They work on goals so they can kind of meet their goals to keep their health in good shape. So in our region, Molina, Community Choice Healthcare Network, and the Community Health Plan of Washington have all been selected as health home leads, and they often refer people to us. A care coordinator on health homes works closely with Medicaid client and the client's health team to develop a health action plan. It's designed to define steps towards improving their health, removing barriers that could prevent achieving the action plan's goal, and just be there for the clients. Sometimes it's just nice to have a third party checking on you and saying, hey, did you remember to call the doctor? Have you returned that form? We also do an elder abuse prevention program. Again, before 2020, we were super active with this, and we haven't had one live since then. And hopefully in 2023, we will start it again. But we usually provide a conference open to community members. It focuses on various topics related directly or indirectly to elder abuse, its prevention, and what to do about it. We also have a very robust video and reading libraries. We have pamphlets on just about everything. We have videos and books on dementia and other health things that we can lend out or give out. You just need to stop by or give us a call and let us know what you're needing, and we'll get it to you. So anytime you want to speak to an information and assistance specialist to find out which services can help you or to see what's going on in your area, just call 1-800-572-4459, and it reaches any of our 3 offices. All right. So that was kind of the presentation. I'm so sorry you guys didn't get the slideshow, but if you'd like a copy, just let me know and I'll email it to you.
Wow, you all are doing a lot. Thank you. And so I think where I always get a little bit confused, even after so many months, is what services are available to who, which ones you have to be on Medicaid and which ones you don't have to, like for the family caregiver support network, is that something, is that the whole household needs to be qualifying for Medicaid, or just that individual needs to qualify for Medicaid?
Okay, so the Family Caregiver Support Program, nobody has to qualify or be on Medicaid for. It's a sliding fee scale, so it's just income based. If your income's low enough, the in-home care is free. And if it's a little higher, you might have a client participation per hour. All the supplies and other services on that program are free though. So emergency buttons, home delivered meals, caregiving supplies, those are all free despite income on that program.
Okay, great. And then just call the 1-800-572-4459 to find out more.
Yeah.
What's available. Super.
Yeah.
And is the home delivered meals, are those do you contract with Okanagan Transportation and Nutrition?
We do. So for people who are not on a program and people who are on our Family Caregiver Support Program, we contract with Okanagan County Transportation and Nutrition. For those on our Medicaid programs and our Medicaid alternative programs, we use a company called Mom's Meals, and they mail out 2 weeks worth of meals at a time. I guess they have a special sealing process to keep them fresh in your fridge for up to 2 weeks. So you get 2 weeks worth of meals, you pop them in your fridge and you're good to go.
Oh, wow.
Yeah.
Yeah, other questions from, welcome Carlin and Gloria, welcome joining us. Good to see you, Carlin. Any other questions out there for Lisa?
Yeah, I kind of went through it fast. So I'm happy to explain anything.
And how is it right now? Because, here in the Med-How, we are having a shortage of caregivers available. And so,
yeah,
is there a big waiting list? Like if you did qualify for somebody coming and helping you out in your home, what could you expect, I guess?
So for your guys' area, there is quite a waiting list because there are no caregivers in your area, but all of Washington State is experiencing a caregiver shortage.
Yeah.
State groups are starting to talk about it and seeing what they can do, but yeah, there's just a caregiver shortage everywhere. The Met has always been kind of short on caregivers, and now that we're experiencing a major shortage, it's even more noticeable up there.
Yeah.
However, like if they did get on a program, there's other things we can do, like the Family Caregiver Support Program has supplies and things besides the respite and in-home care that we can provide. So it's always good to apply and get on the list and see what else the program can do for you.
Right. Right, exactly. Let's see.
I have a question. Lisa, how would we contact the Sheba people? I have a neighbor who would like to talk about Medicare options.
I'm sorry.
Sure. So the Sheba program, you can reach them at 1-800-562-6900.
Also, Jocelyn Karen Renault on our board has been doing that for many years, and she's really, really good. And so
Wonderful.
I can get you her connection too.
That would be great.
Yeah, I
Her
forgot you guys have
information.
a Sheba volunteer up there. That's great to have one.
I
in your area.
know, I
Yeah.
know. Karen is amazing. She's our treasurer, and she's amazing, and she knows a lot about the Medicare because it's a constantly changing landscape.
Yeah.
It's
So,
complicated
bless-
too.
Yeah, it's so complicated. Like,
Yeah.
what supplement?
Yeah, those volunteers are amazing.
Yeah. So I'll get that to you, Jocelyn.
Thank you. And Lisa, where would people get those senior vouchers for the farmers markets?
So they just need to contact Aging and Adult Care in about May. We do run it from May to June, and then all the vouchers are given out. So next year, about May, give us a call and we'll get you on the mailing list and send you out the information as soon as it's available.
Okay, great. Thank you.
Yeah.
And the client, I wrote down client specific fund. Is that, do you need to qualify for the Medicaid for that, or just be over a certain age, or?
No, you just have to be over 60, and then the item you need, you can't afford, and there's no other community agencies that can do that. So like this year, Community Action got funding for air conditioners, but as soon as they run out, then we used our funding to supply those to people.
Mm-hmm. Super.
And we'd access that through you again, Lisa?
Yes. Yep.
Okay.
Yep. Just give me a call and let me know what you need and we'll chat about it.
And on the kinship program, is there a income ceiling on that?
There is. You have to be 200% below the poverty line. I think that's how it's stated. So lower income families. But you don't need to be. Oh, go ahead.
For the chronic disease self-management and just the pain management, it sounds like those are maybe virtual classes that you're getting started up again.
Yep, those are just classes, and anybody in the public is invited to attend, but we haven't done it since 2020. So we're hoping to do it again in 2023.
Okay, so back in 2023.
Yeah.
I know, so much changed.
It sure did.
Okay, so the bottom line is give you guys a call. If anyone has a need, just give you a call, and your information specialists are going to know better how to funnel people.
Yeah, and we keep a running list of current resources in the county and what each agency can kind of offer. So if we can't do it, we probably have a lead on somebody who can help you.
Yeah, that's great. Let me see. And with the tailored support for older adults, that again is more of a sliding scale program.
I don't think
And
I didn't really explain that well. So that program is totally free. If you qualify, it's all free, the in-home care and everything on that program. So to qualify for that program, you of course need to be under the income cap of $2,500 a month, and you would have to need some help with activities of daily living. So either medication management, you have memory problems, you have physical mobility problems or something like that. And that's what will qualify you for that program, but totally free once you qualify.
Do you have to be
Okay.
homebound?
No, you don't have to be homebound for that program.
but there might be a waiting list situation for the Valley if you do
Yes,
qualify.
Yeah, because there's just no caregivers up there right now.
I know.
Yeah.
Luckily, yeah, I feel like we're on the edge of some shift and some changes, hopefully, and
Yeah.
it'll be interesting to see what kind of creative solutions we can keep coming up with.
Yeah, I hope so, because caregiving is such a great career. I did that for a few years, and it's rewarding and it's fun. Your schedule is flexible. You come in and out and do your thing, and yeah, it's actually a really fun job. I hope we get more caregivers up there soon.
Where does one
Yeah.
go for training in that? What kind of programs are available in the Valley or Eastern Washington?
I
So
do know that. Yeah, Jamie's Place is leading it, leading the trainings on that. There's different levels of training. And so they're starting with the basic level. What's the first level of training, Lisa?
I think you like to get your
Assistant.
home care aid license.
Yes, HCA, yes, home care, and then I think there's one that's the next one up. But that's, you can reach out to Jesse at Jamie's Place. They don't quite have it scheduled, but they're going to be doing another one in November.
Yay.
And then that
Yeah,
prepares people to be able to not just help at Jamie's Place, but to go into people's homes and do
Yes.
respite care, that kind of thing.
Yes.
So would
Yes,
they have a
absolutely.
list of people who do that, or is there a list?
Yes, right now there's about 13 people on that list, and for the Valley. And right now they're trying, the list has been in different hands. It's been in the hands of Room One. It's been in the hands of Crystal Blum, who is a personal caregiver, but right now it's resting with Leslie Tregillis, and who's the president of Jamie's Place and also the head of the Lookout Coalition.
Okay.
So if you need Leslie's email, I can get that for you.
Okay.
And I also found out that the high school is going to be offering credits for people who go through that program, which is really
Yeah.
cool. It's
That's
like
really cool.
part of the trade school idea.
Yeah. Oh, I love the trade school, high school idea. That is so
Mhm.
perfect.
I know. I came out of high school with 0 practical skills. What was going on with that? I did not need to graph an ellipse. I needed skills, But yeah, and it's so great. Some students from the ILC went through that here in my space up in the caregiver training. Jamie's Place folks have all their things in my Wellspring space, which is also the Matt Howe at Home office right now. And one of the students that finished that training helps Adriana Van Bianchi, who's doing foot care for folks at my massage office. And so she's getting some experience there.
Oh,
That's
neat.
great.
Yay.
Yeah, it's great.
You're
That's
you're
great.
all kinds of services these days.
We're just yeah, we're not as well versed as our aging and adult care, but we do have a lot going on. There's a lot of needs to try to reach to meet.
Yeah.
Yeah. Any other questions or thoughts out there? I just want to say, but I'm glad that people are having a chance to just see you in person, Lisa. Hopefully they'll feel free to reach out and contact you. Lisa also shares an incredible amount of information. So can anybody get connected up and get onto your email list to get that stream of information that you just really are incredible at gathering and disseminating?
Yeah, anybody can get on that email list, community members, agencies, anybody. Yeah, just let me or let Tracy know and we'll get you on the list.
Yeah. And what is your email if anybody wants to send you an email to ask to be on the?
Sure, let me put it in the chat.
Yeah, Lisa you probably send 2 or 3 emails out a week at least with just a lot of stuff going on.
Yeah, I try to keep it just to 2 because sometimes I can get a little ambitious. I love information and stuff, so I got to remember that not everybody wants an email every day. So I try just to keep it a couple times a week.
Yeah, I know what that, I mean, it takes time to, get that organized and out. So thank you so much for that service as well. And if anyone wanted to come and just browse through the library or see what videos or books, what are the hours? When can they stop in to the office?
Yeah, so we're open Monday through Friday, 8 to 4, and we're at 739 Hostler Road, Suite B. So we are just north of Mid-Valley Hospital. Yeah.
Okay. Hostler,
Haussler. Yeah, I like it when they keep it to like Fir Street, Pine Street, Popular Street. Let's just keep them tree names. It makes it easy.
Okay. Yeah, any other questions out there? And yeah, just so everyone knows too, these are all over the whole country, these area agencies. And so if you have a loved one somewhere else in the country who needs services or help, a lot of times people just don't realize that it's an option and that you exist. So
Yeah, just Google your county and area agency on aging, and it'll pop up which one's covering your county, no matter what state you're in.
yeah, I think that was Lyndon Johnson got this program through.
Nice.
Yeah.
Well, I learned something today too. I knew
I
what
might
act
be
it
wrong.
was,
I
but
might be wrong, but yeah. He did a lot of great social programs.
yeah.
Little, yeah, wasn't so great on foreign stuff, but domestic.
Yeah.
Good leader.
Who can be perfect at everything, right?
Yeah, exactly. Okay, well, super. If here's one more round. Any other questions? Some people are on mute, so if you've been trying to put forth a question, you can always put it into the chat or raise your hand or. Okay. Fantastic. Well, everybody, I hope you get out and enjoy this beautiful weather. And I'm going to go ahead and stop the recording, I guess.